The treatment approaches to depression are different from person to person. It will completely depend on what that person feels is the right thing for them. And I would say any treatment approach is always a collaboration between the person and the professional that they are speaking with. There are three main areas that I think about when we're thinking about treatment for depression: lifestyle, psychological support, and lastly, medication. In terms of lifestyle factors, there are a range of different things that people can change or that people can do to try and help with their mood and to help with their experience of depression. Regular exercise can be something that can be helpful. We know that exercise releases endorphins, which help make people feel happier. I appreciate, though, that sometimes for people with depression, they experience that their energy levels are much lower, so it's not always possible for everyone. And even if it is just getting out for a quick walk for 5 to 10 minutes in the morning, particularly getting a bit of sunlight can be helpful for people. Being mindful of how we eat is important as well. We know that appetite can be negatively affected by depression, and trying to keep to 3 meals a day just to make sure that our energy levels and our concentration and our mood are still not being negatively affected by the way that we're eating is important. Mindfulness can also be really helpful for people. People can sometimes experience that their mind can be really busy, they can have lots of negative thoughts, and what mindfulness can help to do is to train the brain as to which thoughts we want to keep and which thoughts we actually want to just allow to go away again. So regular mindfulness, potentially combining that with yoga, which is a combination of exercise plus some mindfulness techniques, can be really helpful for people. Social life and socializing is also a really important part. As humans, so much of what is important to us is our interactions with other people, and trying to keep up with friends or work colleagues or family can also have a positive impact on our mood. Thinking then about psychological support, the nature of this can vary from one person to the next. One of the main psychological treatments for depression is cognitive behavioral therapy, or CBT. This is a type of talking therapy usually done one-to-one with a psychologist, but can sometimes be done in a group setting where we think about our thoughts, our feelings, our bodily experiences, and our behaviours, and how all of those things interact. How our thoughts and our feelings might lead to a particular behaviour, but in turn then how a particular behaviour might lead to an improvement in our thoughts and in our feelings. And having several sessions with a psychologist can really help to build up initially our understanding of how these things interact, and building up that understanding can then allow us to know where we might want to change things to help us feel better. For some people, a psychological therapy might be too much. They might not want to see a psychologist on such a regular basis, and something a bit less formal like some counselling, which can be maybe just sometimes 3 or 4 sessions, a bit more practically focused about what we're doing on a day-to-day basis, how we might prioritise our work slightly differently. That can also be really helpful for some people. And I think working out what's going to be the right thing for you is always key in seeking psychological support. Thinking then about medication. Medication is often something that people will come to having tried some of the lifestyle things we've spoken about, or having had some psychological support already. Medication generally will be prescribed by a medical professional, a psychiatrist, a GP, and typically that will be an antidepressant. For most people, that will be taking one antidepressant, usually in the morning, though sometimes we might prescribe a medication that's taken in the evening, particularly if people are having difficulties with sleep. We might prescribe an antidepressant that also has benefits when it comes to sleep. For most people, the first antidepressant will be helpful enough that that works well and we don't need to change anything. However, if the first medication doesn't work in the way that we want it to, then there are alternatives that we can try. We might add in another medication to help enhance the effect of the antidepressant. And with medication, we only want to be prescribing things if we know it's being helpful and if it's not causing significant side effects for people. So medication always has to be a two-way conversation. So if people feel that the medication isn't giving them the benefit they want, that the side effects are too troublesome, or even if they've just changed their mind and they don't want to be on medication, that's okay. We can work out a different way of managing things. People typically will remain then on an antidepressant for somewhere in the region of 6 to 12 months. And medication doesn't have to be a lifelong thing for people. It should be reviewed usually after that 6 to 12 month period once people are feeling better. And the hope then would be that we could try a reduced dose or potentially look to stop the medication, not in a rushed way, but in a way that really suits that person, so that in the longer term, their life is functioning in a way that works well for them. So in summary, treatment approaches to depression involve potentially lifestyle changes, psychological support, and medication. But the key factor is that it always has to be personalised and collaborative in a way that gets people back to the way they want to be, functioning the way that they want to be, doing well at work, having a good social life, functioning well at home.